what it's like to be on a clear station out there. So you need to get involved. You need to show up for August 17th. You need to do talk radio. And you need to write letters to the editor, and I think you're going to have a chance to do some of that tonight. I leave that to the organizers to explain later. So August is it. If we don't get the message out in August that there is a lot to love, 10 reasons in the love healthcare reform, we will never get to September, and we'll never get this done. And it will be a great travesty, and it will also be a political problem for the Democratic Party. We're nonpartisan at Families USA, but I'm saying that's just the facts. Okay, so Senate Finance Bill, here's the places where we're continuing to fight to get the best possible measures. We want to make sure that we get the largest possible expansion of Medicaid for low-income families. We want robust premiums for moderate income families through the exchange or gateway, which is a private insurance market. We want a public plan option in that exchange, and we want a strong one. We want appropriately low caps on out-of-pocket costs for people who purchase private insurance, as that is their choice in the exchange. So if they've got the subsidy to help them with the cost of premiums, they also have protection from out-of-pocket spending for services once they buy that coverage. And finally, we actually want a strong employer responsibility requirement. However, we believe there should be a significant exemption for small businesses like Peter's, like my husband's. Small business, I think instead of needing an employer responsibility or mandate provision, need a small business tax credit. And in fact, there is one in all three bills. So those are the things that we're continuing to watch, monitor, and fight for at Families USA. Those are top issues for us. Let me tell you what we've got so far on those issues and what we need to hang on to, and where, I'll be honest, since this is a crowd of friends, where I think we need to keep pushing to get and preserve the best we can. First of all, historic expansion of Medicaid, which serves low-income people and people with disabilities across the nation. It will literally cover millions of people who have never before been eligible for Medicaid. I'll give you some of our stats. The House bill will cover all adults up to 133% of the federal poverty level. The Senate bill actually goes to 150, but I'll be honest, I don't think we'll hang on to 150. We will fight very hard to keep 133. So we want to keep that level. And you shouldn't take that level for granted if you've been following this debate, because there is going to be a revenue shortfall on the Senate side, and so that's where we may see some deterioration. If you don't know, today in this country, in 43 states, it does not matter if you are penniless, you are not eligible for Medicaid. If you do not have children, if you do not have dependents. So parents are basically who are in the Medicaid program. This would give all of those adults with no children, no dependents, access to the Medicaid program. That alone is huge. But parents actually don't do so well in Medicaid either. I mentioned my home state of West Virginia, but if you look across all 50 states, the median eligibility level for the Medicaid program is only 67% of poverty. So half the states, you have to be really poor, even if you're a parent with children, to get into the Medicaid program. The healthcare reform bills on the table, all of them that I've described that are all in motion, all agree that we should expand Medicaid eligibility to 133%.